What is the meaning of chronic inactive hepatitis in the context of somebody who already has hepatitis B? So hepatitis B is the kind of infection which can continue to persist in your liver for a very long time if you don't manage to successfully clear it. These kind of people who are not able to clear the virus after infection become carriers, and they have what is called chronic hepatitis. Usually chronic hepatitis only happens when you have the virus for more than 6 months and your body is not able to clear it. Now there are different states or types of chronic hepatitis, and one of them is called chronic inactive hepatitis. Why I'm making this video today is because a lot of patients are told this by their doctors and they don't know what it means. So chronic inactive hepatitis basically means that you have the virus right now, it is there in your liver, but it is in very low quantities or almost undetectable levels. It may also be such that the virus is not actively replicating, it is just sitting there in a very dormant state, but it is there. It also means that you can spread this virus to other people if they come in contact with you through whatever are the normal transmission modes of this virus. It also means that this virus can again relapse and it can again increase. So what are the basic criteria on which we decide that a patient could have chronic inactive hepatitis? So as you know, there are many different types of tests for hepatitis. You need to know a little bit about hepatitis serology to understand this. I've made a detailed video on that. I've linked to it in the description. But chronic inactive hepatitis basically means that this virus is not actively replicating. And what is the proof that the virus is not replicating? Well, the hepatitis B has an envelope, and that envelope has an antigen. If this antigen is not detected in your blood, then we can say that the virus is not actively replicating. At the same time, there is also an antibody against this antigen, and if that antibody is positive, it becomes even more proof that the virus is not actively replicating, but it is present in your blood because your HbS-Ag will be positive. Other than this, your liver function test, which is called the ALT or SGPT, will be normal. It will be around 40 or so. And if we do your viral load test, which is the hepatitis B DNA viral load, we may not even find the virus in the blood, or it may be at very low levels. So that is the meaning of chronic inactive hepatitis. Inactive means that the virus is not active, it is not actively replicating. It doesn't mean that you don't have the virus. Thank you.